told for too long to think before you act. Well, I'm here to shift that procrastinator mentality. We need to start acting on our ideas, working on our goals and our dreams. Then think about your attempt at greatness. Assess, reevaluate your game plan and your methodology. Take it to a next and a higher level. Then follow up by living it. That's what a boss is. That's what a boss does. JefeTalk.
All right. Welcome back to the JefeTalk podcast. It is your host, Jefe. I am super excited to be back. I know it's been a minute. I have been slacking with these podcasts. And, I suck. I ain't gonna lie. I've been a big advocate of staying on track, having a schedule. But, I have no excuse. I have to get better. I mean, I'm not going to lie. I have a whole career out of this, but I won't even put that out there. We got to stay focused to the plan and goal. So I want to, number one, just say thank you to all my listeners, my supporters, YouTube, Spotify, Apple, you name it. I'm super excited about this one. Now, before I get into who I'm going to be introducing, I want everybody to take a step back and realize that, hey, there's only 2 months out of the year that we shed light on mental health for men. And we happen to fall in November where, just a sentiment of not getting enough attention and not putting enough light on this conversation really has been spoken about. So I wanted this episode to be exclusively for not just men and women, anyone who may be going through different trials and tribulation, who may have a lot of questions and misconceptions about therapy. So I am super excited to have a special guest. Her name is Roshelle Wilder. She is a licensed therapist. Everybody, please give a round of applause for Mrs. Wilder. How you doing today?
Good. How are you?
I'm doing pretty good. I'm trying to get fancy with all these little extra gadgets.
I love it.
But it came in right. But no, I'm doing well. So welcome to the JefeTalk podcast. I want to just give you the floor just to kind of share everybody, just your background, your upbringing and what kind of even got you into the space of therapy.
So, hi everyone. My name is Roshelle Wilder. I'm a licensed clinical social worker. I am a clinical therapist. I have my own private practice. Therapy is Healing. It's a telehealth platform that serves communities in DC, Maryland, Virginia, and Florida. And so what got me into this, my family has definitely struggled with mental health issues, substance use issues. So growing up, I always knew I wanted to be in a helping profession. I didn't know what helping profession I wanted to be in. But once I realized, hey, this isn't normal, that certain things are happening within the household. This is due to mental health. This is due to substance use. And so that's what made me find a passion in helping people and really just being super curious about psychology and the way that the brain works and the way that the world works. And so I have a very personal reason for doing the work that I do, which I think really helps me to be successful because I'm super passionate about it. So yeah, I grew up in Long Island, moved to DC for a while, lived in Miami for a while. So I have a lot of experience in doing this. I've been doing this for about 7 years now.
Wow.
So, yeah.
Okay. So we got some tenure there. Okay, but before we begin, are you a Dolphins fan or a Commanders fan? Who you celebrated?
I've been in Miami for longer than DC.
All right, we could continue. I was about to cut this short if she said Commanders. So I'm glad we got that out the way. But no, I'm super excited to have you on as a guest. As you may or may not know, I always try to get somebody in a field of where they are an expert at.
Mm-hmm.
And I think this will be a dope conversation. So just kind of jumping right into it. I had some great questions. A few guests of mine, not a few guests, but a few viewers and supporters kind of sent in. And I want to let's see if we can go over them a little bit. But one of the questions was, if you can share some insight on the nature of hopelessness and despair. We find that many a times that this affects people emotionally and mentally, whether it's from finance, relationships, just the current, market of what's going on out in the real world. So how do you even start that conversation with somebody to let them know there are resources, or what can people do to start dealing with their own depression when it comes down to that?
Mm-hmm. Mm-hmm. So hopelessness and despair is very complex. But what you'll see or notice is that these people who are feeling hopeless are going to withdraw from things that they usually enjoy. So if you're the type of person that's going to go to a Dolphins game at least 4 times a season, or a Commanders game, or you're going to go work out, you're cooking, you're hanging out with family, you'll notice that if you're feeling hopeless, you're going to withdraw from all of those things. You might start to isolate yourself. You might start to increase your use of substances. You're feeling depressed, way more depressed than usual. Maybe you're sleeping more than normal. You're eating more than normal. Or maybe it's the opposite. You're not eating at all. You're barely sleeping. So when you're feeling hopeless, you have this belief that things are just not going to get better. There is no light at the end of this tunnel. Everything that's a problem just cannot be solved in this mind of feeling hopeless. So you're losing control, you lose confidence and courage, and you just lose the energy to move forward.
Okay, so once we get to that point of feeling we can't go no more or do no more,
Mm-hmm.
what actionable steps you think we can do, right? Because I know myself personally, I deal with just being overwhelmed, and sometimes I hit a brick wall.
Mm-hmm.
And I'm fortunate enough to have a lot of resources just to kind of get me out of that funk. But what do you say to that individual out there that feels, hey, they don't want to tell anyone in their family, might be too personal, they don't want to tell their best friend because it might be embarrassing? What actionable steps you think they can do to maybe reach out to a therapist? Like, how is that even possible for somebody?
Mm-hmm. Mm-hmm. So if you're feeling isolated from family and friends, you don't feel comfortable going to them, there's so many resources out there, so many directories to find a therapist that's going to meet your needs and someone that you feel comfortable with. So one directory that I really love is Psychology Today. So you can literally customize exactly what you want. You can filter it by the insurance that they take, their race,
So,
their
so
religion.
so insurance can cover therapy.
Yes,
Wow.
yes,
Okay. I did
yes.
not know that. I mean, I'm a veteran, so I'm so used to everything being at the VA, but
Mhm,
for non-veterans as well, so insurance can actually cover the cost of it. Because one of the biggest issues, like, I can't afford therapy.
mhm. Absolutely. And I think a lot of people run into that issue of therapy is too expensive. I don't have access to it. And so I think that telehealth has been a game changer since the pandemic. That has become super popular. So
Mm,
just being able to access therapy from the comfort of your own home through your laptop or even your phone. You can be at a coffee shop, you can be at a friend's house, you could be at work on break in your car and have access to therapy. Um,
wow.
and then, as far as insurance is concerned, a lot of health insurance plans do cover therapy, whether you're in network or out of network with the therapist. You could potentially be reimbursed for the cost of therapy. So that's something that everyone should look into.
That's really interesting. Because you know, growing up, you kind of think of therapy as you're laying on a couch. You know,
Mhm.
for those I know who watch Sopranos are used to,
Yeah.
he used to walk in and just lay on the couch and he's just spazzing out, screaming, throwing stuff. So
Mhm.
I kind of want to peel back of what is the actual goal of therapy? Are individuals going to get an end result at the end of it? Is it going to take multiple sessions? Like, kind of walk that person through the experience, because a lot of it really comes down to fear, right?
Mhm.
Not only finances, but just the fear of what they might be walking into. So, how does anyone even pick who to talk to? And then at that point, what is that experience like?
Mhm. Mhm. So I think it's important to talk about and process and reflect on what it is that you're looking for in a therapist. A lot
Mm,
of my clients are like, well, I really just wanted to see a Black woman, right? I wanted someone who had similar life experiences as me. So maybe you want to see someone that has the same skin color as you, or maybe you want to see someone that has the same religious beliefs as you, and maybe they practice therapy for more of a religious aspect. Or maybe you want someone the same age as you. I think that's really important too. A lot of complaints that I get of people are like, I stopped seeing my old therapist because they were 30 years older than me and they just could not relate to my life experiences as a 20-year-old in college. And there was just a huge disconnect. And so therapy definitely helps with improving communication skills, helps you feel empowered. It helps you to recognize things and patterns that are going on in your life that need to be changed in order for you to live a more fulfilling life. So to make healthier choices for yourself, to develop better coping strategies, those are all the goals of therapy. And as far as how long it could take 6 months, it could take 12 months. A lot of people want to stay in therapy kind of like a maintenance thing, like a more of like a coach aspect after that year mark, right? Where I just want to check in and, make sure like, okay, maybe I needed some help with this relationship or this work issue. So just being able to talk through things with someone from a non-biased perspective.
I like that. I think you kind of clear the air just on the options people have. Many people, including myself, I didn't know. I've done therapy before, but I didn't know you can actually curate it based on your comfortability, right? Based on age, demographic, religious beliefs, spiritual background. So, listeners out there, I want you guys and ladies and everyone to understand that, hey, you can kind of design your personal coach, also known as your therapist, based off their credentials and their background. I think just a misconception, and as we get into this next question, we grow up with these just visuals and ideas of what we think a therapist is, right? So segue into the misconception of, especially from a Black community, we don't need therapy, right? We got Instagram, we got Justin LeBoy, we got memes, we got
not Justin LeBoy, please.
Like, it's sad, but for real, people, and I always joke about this, but I'll be like, yo, some of y'all really be giving yourself self-therapy based on memes. And I'm like, y'all gonna have to change that. So how do we get past this idea that we can give our self-help, right, through whatever memes and whatever else we're reading on Instagram or on social media? What can you say to that individual that feels that they don't need it because their parents never did, or maybe just their community is just not a big fan of it? Like, how do you get over that idea that I don't need it?
Well, I want to say that I think everyone needs it.
Okay.
I think everyone could benefit from therapy. Everyone has gone through a traumatic experience. If we're talking about COVID-19, everyone went through that together, and that has kind of been like brushed to the side 2 years, 3 years later, but that was extremely traumatic for everyone. A lot of people go through childhood trauma and have really bad life experiences, maybe with parents or with teachers or coaches, right? And those things need to be unpacked because they impact your everyday relationships, especially your romantic relationships.
That's really interesting. I think realizing what you just said, when I talk about working on the subconscious mind, which I do a lot, and I talk about just the mindset, there's a lot of barriers that is kind of embedded in our DNA. I actually had a guest, a few episodes ago, and she was just talking about how our family members and just the DNA itself has past traumas that somebody has to break that barrier, and it has to be unpacked. So I find it interesting that you said that there's certain things that, sometimes you can't even explain within yourself that is happening in your habits or your rituals or whatever you do, and you can't explain why you respond the way you do. So I think that's really important when it comes down to relationships too, because many of times we're always quick to blame the other person, right? We're always like, he did this or she did this. And 9 times out of 10, we're putting ourselves in that situation, right? And this is no excuse for BS that we go through in relationships from others, but we always have that choice to say no. We always have that choice not to go in the same cycle again. So I think it's cool to also know that therapy can help with not only mental anguish and depression, but just your walk in relationships.
Mm-hmm. Mm-hmm.
So that's super cool. Okay, so kind of leading into the conversation of recovery, and we talked about finding hope.
Mm-hmm.
How does somebody stay motivated and resilient on the process of therapy?
Mm-hmm.
I can't tell you the amount of times I've met people that be like, yeah, I did therapy. I did like one session, like I'm good. I'm healed. Or whatever it may be. So how does somebody get a confirmation to know, hey, I did enough sessions? I mean, or like what's that motivation to kind of keep them going through the process? And then where's the confirmation to know that, hey, this was more than worth it?
Mm-hmm. Mm-hmm. So, in the beginning, when you first start therapy, you should be setting goals for therapy. And so, what that means for the therapist is creating a treatment plan. And so, once you check off, okay, I hit this goal, I hit that goal, I hit this goal, right? I'm working towards these things, and everything is going in an upward direction, then that means, hey, maybe I don't need you anymore. Maybe I have your voice in my head and I can kind of coach myself through these issues now. Maybe it's been 3 months, maybe it's been 6 months, but definitely not after 1 or 2 sessions. That's just not realistic.
I see what you're saying, because sometimes we feel that once we accomplish that, it's like a check mark in
Mm-hmm.
our head, like, okay, I did it.
Yeah.
Right. So that also can be exposing an underlying fear
Mm-hmm.
of what it might bring out of you, or what change might come up upon it. So I
Mm-hmm.
think that's really great advice. So when we going through the process, we're getting through these barriers. When do we know that we might need more than therapy, right? What are some of the severe red flags that
Mm-hmm.
you kind of see in your profession that, hey, I think at this point, it's only so much I can do?
Mm-hmm.
What are those signs that you look for? And also maybe some people can identify that, hey, they might really need some other type of or form of help to help whatever they're going through mentally and emotionally.
Mm-hmm. Mm-hmm. Yeah, so I would say if your hopelessness and your despair is lasting longer than a week or two, then you may need some more help. If you're going through therapy and therapy is not working, maybe after a month or two, you might need more help. If you're eating or sleeping for too much or too little, if you're not engaging in things that you used to be super engaged in, you have low energy, you have aches and pains, you're using substances in a way that you've never used them before, right? Increased use. You're worrying a lot of the time, you're feeling more anxious than usual, you're not able to really readjust to your personal or your work life, then maybe you need something else. And so when I have clients like that and they're not improving with just therapy alone, I'll recommend medication. So, medication and therapy is a great combination and a great tool in overcoming depression. Sometimes therapy just isn't enough. We often don't talk about the chemical imbalance that's happening in someone who is experiencing depression or anxiety. And sometimes that medication with therapy can be that extra boost that they need to move onwards and move forward.
Wow. So chemical imbalance is a real thing.
Mm-hmm.
That's a real thing. And you hear it, but when you think chemical, you don't think, how does that relate to me? Right.
Mm-hmm.
So so can you dive a little bit deeper? What is a chemical imbalance, and how do I know that? Or is that something that the therapist or the doctor can actually identify? Or can a person say, you know what, I have a chemical imbalance? Because, I hear a lot of people say cliche, or if I hear somebody get in an argument, oh, her balance is off, or, whatever it may be.
Mm-hmm.
How do you identify that where, hey, there is something that might need to be, how do you say, I guess, regulated
Mm-hmm.
based off the sporadic different things that person may be doing?
Mm-hmm. Absolutely. So that's when you would go and see a psychiatrist, right? And they would thoroughly evaluate you, and you would see maybe your PCP as well. Sometimes it's interchangeable. Some PCPs are comfortable prescribing psychiatric medications, sometimes they're not. I always think that it's best practice to see a psychiatrist if you're going through psychiatric issues. They're an expert in that field. And so they will do lab work and as well as doing like a thorough history and exam. And then they will determine, hey, okay, this is going on for you. And I think you should take this medication.
This is great. This is great because what you're, sharing and expressing to people that there is resources
Mm-hmm.
of actually pinpointing what's going on.
Mm-hmm.
I think sometimes we sell ourselves on the idea that, hey, this is just me. This is who I am.
Mm-hmm.
There might not be something wrong, or maybe it's always everyone else. Maybe just people don't get me,
Mm-hmm.
right? I hear a lot of individuals that always share like, hey, I'm just different.
Mm-hmm.
And I think sometimes we sell ourselves on that concept and our idea just to not go through the process of getting a therapist.
Mm-hmm.
So I find it really interesting that you mentioned that there's actually ways people can actually pinpoint and identify. And I guess you're the plug. We can come to you for let me stop. All right, but in a way you are the plug. You're giving people informed information and
Mm-hmm.
also at the same time you can actually put them on the right path of getting the medication they may need, correct?
Mm-hmm. Absolutely.
Okay. That is dope. That is dope. So I think overall, for especially mental health, men's mental health for this month, I want this to be a great avenue, just a great resource to understand there is help.
Mm-hmm.
There are individuals like Miss Wilder out there that can literally help you understand what you're going through, the trials and tribulations, and then also at the same time give you resources.
Mm-hmm.
So as we start wrapping up, I want to kind of get your take on what is your thoughts on just people struggling in the economy, right?
Mm-hmm.
How do because there's a lot of talks about we're going to another recession soon. People are losing jobs, getting laid off. It's so much going on. So how do we know what type of therapy we need
Mm-hmm.
when we're getting hit left and right with so many different things that's affecting our emotions? How do we know where to start?
Mm-hmm. Mm-hmm. Yeah, that's a tough one. I mean, money is definitely probably the number one most stressful factor in Americans and adults' lives,
Mm,
right? Like
yeah,
even more
sad.
than our relationships. Um, so, as far as how the economy goes and things like that, focus on what you can control. You cannot control the
I like
economy. You cannot control inflation. You cannot control these crazy interest rates. What can you control? You can control your budget, right? You can
Mhm.
control call on Uber Eats or
Talk
get
about it
on Uber Eats
exactly.
every week. That's something that you can control. So where can you cut cost? Can you, instead of ordering Uber Eats twice a week, can you order maybe twice a month? Is that something
Mm.
that's feasible for you? Instead of going to Saks, can you stay home and read?
Talk my language. Talk about it.
Can you look in your closet and see what's already there, right? And I think that's what 2020 taught us is that hey,
Yeah,
you don't know what's going to happen, so you have to save for that rainy day, and you have to have a budget.
I love that. I love that. You actually said one of the quotes one of my favorite mentors always told me, and he said, "Control what you can control."
Mm-hmm.
Whenever you feel things are too sporadic, you got too many things going on left and right, and you're like, where do I start? But
Mm-hmm.
like you just said, what can you control? That's where you start
Yeah.
because that is probably the easiest access to regulate or fix what that problem is
Mm-hmm.
because you can control it. So I
Absolutely.
love that. I love that. So what I want to know, all right, I have to ask these questions. What and of course I know you have guidelines and restrictions.
Mm-hmm.
What is probably one of your most craziest session without disclosing too much, but what is one session you went through that was kind of just off the wall that was like, okay, this is not something that this is more than therapy? Like, give us probably one of your crazy stories.
Mm.
I had to
So
throw a
I have
curveball.
a lot of crazy stories.
Okay,
I've
okay.
worked in psych and emergency rooms and inpatient units for many years. So, um, what I will share is a success story that I think
Awesome.
would be
Okay.
helpful, which was actually a young Black male client that I've had who has been through a lot since we started working together. And even before that. So when we first started working together, he came in because he was in a really terrible car accident, and
Wow.
he had a lot of injuries, and he could barely walk. He could barely get around. He couldn't work at all. And so he's been able to overcome that through physical therapy. And it really impacted his mental health, as you can imagine, being a man, not being able to work, not being able to get around because he had this intense fear of driving afterwards. So he would not drive anywhere for a year. And we worked on that for a year. And now he's driving.
Wow, that's
Also,
awesome.
He also went through sexual trauma, molestation by a family member when he was young, and he really struggled with romantic relationships. He wasn't comfortable being touched physically, and now he's in a relationship. He's been in a relationship for 6 months.
That's dope.
And so I'm really proud of him in that story because he's just shown that he's very resilient. He's been extremely committed to the process, extremely committed to therapy. And I think that that's probably one of my favorite
I love that.
stories.
No, I love that. And she definitely has PR training because I was trying to get some, but she spun that into the most successful story. And I loved it though, because that's what we should be talking about. We should be talking about the success of therapy and how it can help and bless somebody. So I'm really happy you segue into that. And I think this was a really great, productive conversation. So I want everybody to make sure you take the time, rewind this, stop it, pause it, and make sure you guys take as many different notes you need to kind of help you on that roadmap. So I really want to say thank you, Miss Wilder. If you have any last words, please kind of tell everybody how they can find you, as well as your contacts if you want. We would love for you to put that out there so people can reach out to you.
Yes, absolutely. So I also just want to say about this recording should not be a replacement for professional help. If you're having any mental health issues or any financial issues, look after your well-being and see a professional. There's no shame in being brave and asking for help. As far as where you can find me, therapyishealing.com. You can find me at Love Wilder on Instagram or Therapy is Healing on Instagram. And there's a bunch of resources on my website. So if you are looking for some help or if you need some type of resources, that's a great place to go. And I just wanted to say thank you for inviting me on this podcast. It's an awesome experience. It's been really chill, down to earth, like we said, like a living room conversation, which is really, really helpful for me who's new doing podcasts and things like that. So
no, you did great. You did great. I really appreciate you coming out and just doing this podcast because this can change, and I'm pretty sure it's going to change a lot of people's perspectives and mindsets when it comes down to therapy. So number one, I want to thank you for showing up. To my listeners and supporters out there, remember, JefeTalk is about acting, thinking, and living, right? And when we talk about acting, the slogan is, right, take action, take execution to a highest level. Don't overthink things. And I think sometimes we overcomplicate things. We become so complacent, before you know it, months go by, years go by. So if you feel compelled by this conversation, if you feel that, hey, you know what, I might need therapy, maybe a loved one, or, maybe one of my children, or things of that nature, take that action. I think this has been a really impactful conversation. Until next time, this is JefeTalk, and we are out.
Bye-bye. Thank you.